Hi, today we're going to talk about hiccups from the medical point of view. Hiccups are a universal phenomenon that can strike anyone, anywhere, at any time, even from the presidential podiums to the dinner table. Hiccups have been known to interrupt even the most dignified of occasions, right? So if you're ready to explore the science behind hiccups and even learn when to seek for medical advice, then stick around and subscribe for more. All right, so irrespective of the numerous causes of hiccups, they all seem to have one thing in common, and that is the hiccup reflex arch. So we're going to delve into the areas that are involved. Now, you recall that hiccups occur when there is a sudden involuntary contraction of the diaphragm as well as the intercostal muscles. So how does that occur? We're going to take a look at certain pathways. We have the afferent pathway, the brainstem, and the efferent pathways. So when we say afferent pathways, it actually includes visceral and somatic nerves such as the vagal nerve, phrenic nerve, and sympathetic nerve, and they actually transmit sensory signals to the brainstem. So, for example, a pancreatic tumor may compress the vagal nerve. A subphrenic abscess may irritate the phrenic nerve and activate the afferent pathway. That information can be relayed to the brainstem, which will process it and then give a feedback to the diaphragm and the intercostal muscles, but this time via motor fibers of the phrenic nerve and accessory nerves, respectively. Now, in the next slide, I'm going to show you exactly how the hic sound is produced. So that said, we can actually make sense out of this by saying that any pathology that affects the afferent pathway or the brainstem or the efferent pathway can lead to a formation of hiccup. Now, the most common reason is often due to gastric distension by eating too fast or excessively, or any irritation of the GI tract, such as consuming carbonated drinks, taking alcohol, smoking, gastroesophageal reflux, sore throat. They can all affect the reflex arch. Other possible culprits may also include infections, neoplasias, electrolyte abnormalities, diabetes, surgery, as well as the post surgical periods. Psychiatric impairments and even certain medications can also affect the afferent, the brainstem, as well as the efferent pathways and lead to hiccups. Now, additionally, neurotransmitters like dopamine and GABA also play a crucial role in this process, which is why certain medications that inhibit these neurotransmitters may be used in hiccup management. So when the hiccup reflex arch is activated, it sets off a chain of events that causes a sudden onset of intermittent contraction of the diaphragm as well as the intercostal muscles, which we already mentioned. And these contractions leads to a rapid or sudden inspiration. This in return will draw air rapidly into the lungs and subsequently lead to a sudden closure of the glottis. And this produces the characteristic hic sound that we are all familiar with. So according to duration, hiccups may be classified as acute if it is less than 48 hours, persistent if it is more than 48 hours, and intractable if it is more than 1 month. Regarding clinical manifestations, hiccups can affect anyone, including your favorite celebrities, but the good news is that they are usually self-limiting. Severe and prolonged hiccups can have a significant impact on an individual's overall well-being. Persistent and intractable hiccups can also cause exhaustion and fatigue, making it difficult to concentrate as well as perform daily activities. The constant interruption to normal breathing can also lead to anxiety and stress. Prolonged hiccups can disrupt sleep patterns, causing insomnia and daytime fatigue. Furthermore, the inability to eat and drink normally due to hiccuping can also result in malnutrition, weight loss, and even dehydration. The diagnosis of persistent and intractable hiccups are indeed a straightforward process. A thorough neurological examination is performed evaluating coordination, power, tone, vision, and sensory functions to rule out any underlying neurological conditions. An abdominal examination is also necessary to assess and identify any potential causes of hiccups. Laboratory investigations may be required to rule out infections as well as renal failure. You recall that uremic syndrome can also be a cause of hiccups. Imaging modalities such as MRI, CT scan, and a chest x ray may be ordered to identify any structural abnormalities. In some cases, endoscopy may also be used to investigate esophageal and gastric disorders that could be contributing to the hiccups. Management. So, hiccups are common and usually harmless, and they resolve on their own without medical intervention most of the time. However, in cases of persistent and intractable hiccups, medical therapy may be necessary to alleviate symptoms. Pharmacological agents such as chlorpromide, metoclopramide, baclofen, and gabapentin may be effective in stopping the hiccup spasms. Additionally, non-pharmacological approaches like phrenic nerve blockade, diaphragmatic pacing, vagal nerve stimulation, acupuncture, and nasogastric tube may also be employed. Now, your favorite part. So, the home remedies may include swallowing a teaspoon of granulated sugar, tongue traction, the frightening tactic, drinking water or gargling, massage of the soft palate, and a Valsalva maneuver have all been reported to alleviate hiccups in some cases. Thank you, and I hope this was useful. If you enjoyed it, then hit the like button and subscribe to the channel. Bye.